Hello, my friends, and welcome back to another episode of Grounded. Today, we are talking about how to find a doctor who will work with you slash for you in the confusion of the world of doctors. So, if you have a vestibular disorder, you may feel like you have seen every doctor known to mankind on this planet, and none of them have been able to help you. And this is not an uncommon story. Seeing 15 to 150 different doctors are all numbers that I've heard of. So, in this episode, I want to give you more information about how to find the right doctor, what you should look for, how to call the office, and what you're actually looking for from a doctor. And let's start there. I always say this thing that's a little bit funky and kind of funny and a little bit confusing, and I'm going to say it, which is we all go to school for a very long time to do a very niche, specific thing. The job of your medical doctor, so they will have letters after your name, after their name that say MD or DO, or a nurse practitioner, so NP, N as in Nancy, P, or maybe there'll be a PA, so physician's assistant. Those doctors go to school for a very long time to do the very specific thing of prescribing medication, diagnosing, and providing referrals, referring you to imaging, things of that nature. This gets a little bit frustrating because a lot of people say, well, why doesn't my doctor give me lifestyle changes? Why doesn't my doctor give me a ton of supplements to take? Why doesn't my medical doctor do XYZ, remind me to exercise or breathe or whatever? And I'm not saying that this system is perfect. It is far from perfect. It's actually highly problematic, and that's a conversation for another time. But are you feeling alone, frustrated, and dizzy in your vestibular journey? Small group coaching offers personalized support to guide you through. With less than 10 members, you'll have a dedicated chat room for 24/7 support, lifetime access to our content, and weekly meetings led by Doctors Madison and Jenna. Our 9-week program covers specific topics each week, designed to help you break the dizzy, anxious, dizzy cycle and find relief from chronic symptoms. Don't navigate this journey alone. Join us and make huge changes in your vestibular journey today. Take it from small group coaching graduate Lindsay. She says that when I started small group, my life changed almost immediately. I finally had other people validating my symptoms and I felt heard. The insights and expertise that both Madison and Jenna provide are priceless. With the information in the course, I learned what was happening in my body and I was able to move from a state of hypervigilant stress and anxiety to a place of understanding. I am not in remission yet, but I'm having less attacks per month and the severity of each has decreased. I used to wake up each morning and think, how dizzy am I today? But now I get up and will often forget to scan for dizzy symptoms. I'm regaining my life and learning how to find joy in my everyday experiences again. Learn more at the link in the show notes below. When you are going to the doctor, you have to remember what you are asking for. You have 15, maybe 20 minutes, probably more like 10 to 15, to tell them your story and ask for something that you need. Now, this is not the time to go down the rabbit hole of every attack you've ever had, every symptom you've ever experienced, every frustration you've had, and use it as a therapy session. And this might sound rude, but this is not rude. This is very intentional and actually very specific for a reason. Because if you do that, you will use more than your allotted 15 minutes of time. You won't get a prescription. You won't get a referral. You won't be able to better understand what your diagnosis is because we've now used the time. You go to your therapist to talk about emotionally difficult things. You go to your physical therapist to talk about how to exercise again. You go to a functional doctor to talk about detoxing. You go to a therapist or a physical therapist for exercises on how to breathe, or join Vestibular Group Fit. We have tons of holistic, natural, comprehensive options in VG Fit. And I want to be very clear about this because a lot of people say to me, well, I went to my doctor, I got my visit, and they sent me home with an SSRI, and I don't understand why. Although it is technically their job to explain to you why you've been prescribed a medication, oftentimes they don't have time for the educational component of that because there literally is not enough time in 15 minutes to do all the things, to hear you out, and to get to what you actually need. So if they say, here's, let's say, Effexor, I'll see you in 3 months, or I'll see you in 6 months, that's actually really standard and really normal for your medical doctor. And if you want something more comprehensive, you're likely, not always, but you're likely going to have to find another provider. So I'm going to kind of list the things that different diagnoses need. Most people, when they feel dizzy, they say, okay, it's my inner ear, I'm going to go to the ENT. ENT stands for ear, nose, and throat doctor, which means they technically do treat your ears, also your nose, and also your throat. Some ENTs hate, I would say, venture to say most ENTs hate treating dizziness. They prefer to treat nasal disorders or sinus disorders, or they prefer to treat throat issues, but not necessarily inner ear disorders. Inner ear disorders are best dealt with by an inner ear ENT. Now, this is a very, very specific, very, very niche job. I don't know how many of them exist, but a neuro-otologist, which is technically a surgical field for most of them, I believe, is actually who you should go to if you have an inner ear issue. Most ENTs can help you out with the diagnosis of vestibular neuritis. That's a very common diagnosis. And they can say, oh, if you're in your first 72 hours of vestibular neuritis, then you could have a steroid pack and then send you on your way. That's all they're going to do. And then refer you, because remember, referral, medicine, diagnosis, refer you to a physical therapist likely. That's the job of an ENT. If you have neuritis, if you have Meniere's disease, if you think you have recurrent BPPV, those types of things can go to an ENT, but do call the front desk and say, hey, does this doctor treat dizziness? Does he or she enjoy to treat dizziness? Is that something that you see this doctor treats efficiently and effectively? Or should I see someone else and do you have a referral for me? That's what you should call the front desk and ask. Now, finding these people is no easy feat. And I know that. So I'm going to provide you with some resources of people who do like to treat dizziness and how we know that they like to treat dizziness. But again, this is frustrating. This is confusing. This is hard. And I also want you to know that not all neurologists treat what you think they treat. All neurologists are neurologists. They are nerve, brain, spinal cord specialists. That is a general term. A neurologist could be someone who treats stroke. A neurologist could be someone who treats spinal cord injury. A neurologist could treat only nerve surgical necessary disorders. They could treat MS. They could treat brain tumors. They could treat spinal tumors. There are a bajillion types of neurologists. So calling up just your general local neurologist might not be the best option for dizziness because, again, most medical providers do not enjoy to treat dizziness. We exist. I love treating dizziness. My colleagues love treating dizziness. We are obsessed with dizziness, but we are few and far between. So again, this goes back to calling the office and say, hey, does this provider treat dizziness? Most specifically, because the most common neurological form of dizziness and vertigo is, guess what? Vestibular migraine. It's the most common one. It's common enough that it is 3% of the entire adult population. It's a lot of people. It's not a rare disease. It's not a rare disorder. It is common. You need a headache specialist. This is a very specific type of neurologist who specializes in headache management. And yes, this is true even if you do not have head pain. This remains true if you have a migraine disorder that causes you dizziness and vertigo, like vestibular migraine. Some people call it migraine-associated vertigo. That's an older term for diagnosis. It's now all considered vestibular migraine, but that is something to first and foremost understand that you need to see a specific kind of neuro. So if you call the neurology office, the front desk is going to pick up and you can say, does this person have a specialty in head and face pain? Does this person have a specialty in headache medicine? And they will know what you're talking about. And if they don't know what you're talking about, it is time to go to a different specialist. Now, if you are in the States or you have a +1 phone number, so you are in Canada or North America, you can use Neura Health, and I will link this below. Neura health.co, neurahealth.co. The code that I have an affiliate with them. It is Vertigo Doctor, all capitalized 15. So Vertigo Doctor 15, all one word, all caps. And that will get you, I think, $15 off of your first subscription cycle. It is a subscription program, and then you pay. Some of it is covered by insurance, some of it's not. So it's just going to be dependent on you and your personal needs. But they are great headache specialists. They also treat triple PD now and other neurological disorders, but it started off as a headache only clinic, and that can be something that's really helpful. You can find a headache specialist in your area. There are about 700 in the United States, so there's definitely not that many, but that does not mean you don't have that doesn't mean you don't have one locally. So the waiting lists are long. NeuroHealth is quick. They'll usually get you in like 2 weeks or so. And again, you can use that code. They gave me a code because I referred so many people there. The next place that you can find a headache specialist is headaches.org. I will link this below. They have a list of physicians based on state. And then if you are in Canada, Migraine Canada has a list that I will also link for you. If you're looking for people who generally treat dizziness, vestibular.org/healthcare-directory is also a really great resource. And I know there's one in the UK too, which I don't know off the top of my head, but I will find for you and link in the show notes. So there are vestibular specialists. I think the UK list is just physical therapists, but if you can find a physical therapist near you, they will probably know who to refer you to generally treat dizziness from a medical doctor perspective as well. And this really goes back to needing a whole entire host of people to help you with this treatment because it is a comprehensive requirement for treating these disorders. What that means is, yes, you need a headache specialist if you have vestibular migraine, or you need a neurologist who understands how to treat it or whatever. You need someone who can treat it for you, help you with it. You probably need a physical therapist to help you with movement, to help you with vestibular rehab. You probably need a dietitian to help you with your diet. You probably need a therapist to help you with the anxiety. A lot of these things from a general perspective, actually all of these things are covered in vestibular group fit. So if you're like, I don't have a neurologist, I don't have a headache specialist, I can't go to a telehealth online one or whatever, that's fine. We discuss all of the things that you could possibly need to do to manage your vestibular disorder, especially vestibular migraine, in vestibular group fit for a fraction of the cost. Some of these doctors who treat vestibular disorders will cost you $800, $1,000 an hour. And if you really need like a good basis of what things that you actually need to do to treat your vestibular disorder efficiently and effectively, vestibular group fit is that option. So definitely join us there. Don't forget to use the code grounded. It is incredibly effective as a program. It is really, really helpful, and it will assist you in feeling better. The results from there, like you heard at the beginning of this podcast, are unbelievable. Well, they are believable because, I mean, that's why I invented the program, but it feels unbelievable to be like, wow, people really do get better from this, and people really, really, really do. So it's just going to take time and consistency and the attention behind it. In Vestibular Group Fit, we also have a list of trusted vestibular providers, whether they are physical therapists, naturopathic doctors, medical doctors, DOs, physician's assistants, NPs, whoever, who other people in group or who I have treated in the past have told me have been helpful and effective for them. Of course, there's not going to be a great fit with every single person and every single provider, right? And trial and error is going to be an important part of that. But that list of trusted providers is in Vestibular Group Fit for your use at all time. If you're a member and you haven't seen that yet, it's under the support tab in your dashboard. You just click support, and then on the upper right-hand corner, it will say list of trusted providers. There are providers all over the world. They're mostly US based, but we have some in the UK, many in Canada, and in many other European countries as well. So that is something to recognize. The next thing that I want you to best understand is that a lot of people go to the doctor or go to the emergency department, excuse me, when they're having a vestibular attack. And there's nothing wrong with this generally, but we want to remember that the job description of an emergency room or an emergency department physician, ED physician, is to save life and limb. I'm going to repeat that. The job of an emergency department physician is to save life and limb. So if you are not having a stroke, if you are not dying, having a heart attack, have a immediate need for I don't know, brain surgery, or there isn't something like going through you, or your limb is not falling off or broken, they don't really know what to do. Dizziness for them, their immediate red flag is you have a brain tumor, which we know is not more common than vestibular migraine or BPPV. Like those things are way more common. But again, their job is to save life and limb. And we use the emergency room for a lot of things, right? Like I have been to the emergency department many times, everything from broken bones as a kid to slicing my hand open trying to cut brownies to lots of different things. And a lot of people use the emergency department for migraine and vestibular migraine and dizziness as well. And I'm not saying not to do this, but I want to teach you how to do it the right way. Because if you go in there and you're like, I'm dizzy, they're going to give you a CT and be like, you're fine. We don't really know what to do and send you on your way. You're going to go home. You'll be just as dizzy. I want you to first go to your neurologist. I want you to talk to them about how often you end up with attacks that send you to the emergency department. If it is more frequent than 0 times, you need a plan of attack for when you get an attack that lasts that long. What does this look like? There are different things that emergency physicians can give you in an IV or orally or whatever that are going to help you break the attack. So whether you need an immediate IV of insert cocktail of medications here, whether you need oral medications, whatever that looks like for you, I don't know. That's not my job. That's the job of your headache specialist. But what you can do to do this the right way is you say, hey, I have this piece of paper that has my prescription on it that is signed and on letterhead from my physician that says, hey, this is what I need when I come to the emergency department. I have this type of migraine disorder. It causes these symptoms for me. And when I have these symptoms in the middle of the night and my doctor's office isn't open and I can't get an appointment for 10, 12, 15 weeks, I need to go right now to the emergency room. This is the piece of paper that I bring. And I'm not going to list what things could be on that paper because it really could be anything from Valium to Benadryl to something that goes in an IV. I don't know. But what I am saying is you and your doctor need to have that discussion ahead of time so that when you need an acute medication, you know what it is and you can ask for it at the doctor. Because the more you know ahead of time, the more you can ask for things from your doctor, the easier that your management of your vestibular disorder becomes. This is especially true with vestibular migraine. You could ultimately have a similar plan of attack if you have vestibular or if you have Meniere's disease, same thing. If you know that some sort of IV injection thing at the ED is best for you, then that could be an option as well. It's just something you need to talk to your doctor about. I know many more people who have this plan of attack with their vestibular migraine provider rather than with their ENT for Meniere's disease. And do know that if you have neuritis or if you have BPPV or something like that, you do not need a plan like this. Vestibular neuritis typically is a one-time event, and BPPV needs to be treated by an Epley maneuver, and most physical therapists know how to do this, or other cannula repositioning maneuver, I should say, not just Epley maneuvers. And if that sounds like you and you are a person who has recurrent BPPV or something like that, and you know it's BPPV, it's definitely not vestibular migraine or something presenting like BPPV, which I usually recommend people get evaluated for, especially if it's recurrent anterior canal. If that is the case, then I recommend just having kind of a physical therapist that you trust, that you know, to say, hey, this is what happens when I have BPPV. This is what I need from you. I need to be able to get in within a day or so. Do you usually have slots for that? And some physical therapists will be like, yeah, for sure. And some physical therapists are like, no, absolutely not. So hopefully this was helpful. Just a little recap. If you have vestibular migraine, you need a headache specialist or at least a neurologist who understands headache medicine, even if you do not have head pain. If you have Meniere's disease, you need an ENT who treats Meniere's disease. Not all of them do. If you are in Canada, Migraine Canada has a great search for physicians. If you are in the States, you can use vestibular.org, you can use headaches.org, and you can use the trusted doc in vestibular group fit from anywhere in the world. Um, a neuro-otologist can also be really helpful. A really common neuro-otologist who I feel like everyone knows is Dr. Shin Bei. He is a neuro-otologist, I believe, and he can be super, super great. He can see people in like 8 states, I believe. If you want medication and a diagnosis and referral, head to your medical doctor. For other things, you need other providers. Don't forget this. You cannot get mad at your doctor for prescribing you medications. It's literally their job. Their full-time job is medication prescription. Should that be the case, we should probably have our doctors talk to us about exercise and eating right and pesticides and reducing plastics and inflammation and breathing and walking and social connections and all the things. But that's not what your medical doctor is for. It's just not. And so you cannot have this expectation that your medical doctor is the end all be all of treatment. If you have a vestibular disorder, you need more than one provider. You need more than a medical doctor. And that is the way that you are ultimately going to feel like your best self. If you're just relying on your MD for all of the things, it's not going to work. So hire a vestibular physical therapist, join us in vestibular group fit, have a functional medical doctor who you trust, a therapist who you can talk to, a support system. And this is hard to do. And I understand that. I feel like I'm probably preaching to the choir right now of people who understand, like, yeah, I do need more than one person. But these are the things that we need to better understand is that you cannot rely only on your medical doctor for full treatment of your vestibular disorder because it is a multi-factor, multifactorial, comprehensive treatment that is needed. I hope this makes sense. Please let me know if you have any questions. I am um, at the Vertigo Doctor everywhere, which I think you guys probably know already. I love you, and I will see you next time. Bye.